Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. In today's Histology of Endocrine Systems lecture, we are going to discuss the histology microscopic picture of the thyroid and the parathyroid gland. So the thyroid gland is located in the anterior neck region adjacent to the larynx and trachea. Thyroid gland develops from the endodermal lining of the floor of the primitive pharynx, and thyroid follicle is the structural and the functional unit of the thyroid gland. So thyroid gland basically having the two large lobe. It is about 5 centimeter in the supra-inferior dimension and the 20 to 30 gram in weight on either side of the larynx and the trachea. The lobes are connected by the thin band called the isthmus. So histologically, the structural and functional unit of the thyroid gland are the thyroid follicular cells. So hundreds of thousands of follicles are present in the substance of the thyroid. The thyroid basically is covered by a thin capsule which stands in septa and divides the substance into lobes and lobules, and each of the lobe and lobule is formed by hundreds of thousands of the follicles. So size of these follicles vary from 0.2 millimeter to sometimes 1 millimeter in size, and these follicles are filled with a gel-like mass called the colloid. The follicular epithelium contains basically two types of the cell. It is generally simple cuboidal epithelium in nature, but in case of inactive gland or when it has emptied its secretions, the epithelium may be the low cuboidal or sometimes even squamous as well. Two types of cells you can see in the epithelium. These are the follicular cells and the parafollicular cells. Follicular cells are responsible for production of thyroid hormone, that is T3 and T4. They exhibit a slight basophilia and having the spherical nucleus with one or more prominent nucleoli. The Golgi apparatus usually present in supranuclear position. Lipid droplets are also seen, and PAS positive droplets can also be seen with the appropriate staining. In addition to these lipid droplets and supranuclear Golgi apparatus, the thyroid follicular cell showed all the properties associated with the secretory and the absorptive cells. So the small membrane bounded vesicles are the secretory granules, and larger vesicles are that of the colloid resorption vesicles. In addition to this, you can also see the desmosomes are the tight junction in apical region which are present over here, and surface of the villi show the microvilli, short microvilli, which are present at the apical surface. Numerous profile of the rough endoplasmic reticulum are also present in some basal region. Small vacuoles present in apical region are morphologically similar to the vesicle associated with the Golgi apparatus. Abundant endocytotic vesicles, which are the colloid resorption vesicles, and the lysosomes are also present in the apical cytoplasm. So these are the glycogen resorption vesicle. These smaller are the secretory granules. Here you can see the supranuclear Golgi apparatus basically located rounded nucleus. Sometimes the basal region you can see the profiles of endoplasmic reticulum as well. In addition, you can see the tight junction in the apical region, that is desmosome, and on the apical surface you can see the microvilli which are present, which are in contact with the colloid and responsible for absorption of the colloid, and also the deiodination pump is located in this microvillus border. So parafollicular cells are located in periphery of the follicular epithelium and lie within the follicle basal lamina. These cells have no exposure to follicular lumen, so they have a short height. They do not reach up to the follicular lumen, and they secrete the hormone, that is the calcitonin. This calcitonin hormone regulates the calcium metabolism. These cells on routine H&E stains, also called the C cells, are pale staining and occur as either solitary cells or small clusters of these cells. So human parafollicular cells are difficult to identify with the light microscopy. Another important point you must remember from MCQ point of view, first they regulate the calcium metabolism. For blood calcium levels actually activate the higher calcium level, actually activate the calcitonin, and calcitonin lowers the blood calcium level and increases the resorption of the calcium from by the bone. Second important point is that these cells, which are the parafollicular or the C cells, are derived from the neural crest cells. So this is also important MCQ as well. At the electron microscopic level, the parafollicular cells reveals numerous small secretory vesicles which range in diameter from 60 to 550 nanometer and the prominent Golgi apparatus. This is the important identification point at transmission electron microscopy, that you can see the large number of small secretory vesicles. So this is a transmission electron microscopy of the parafollicular or C cell, and in which you can see large number of the secretory vesicles which are typical of the parafollicular or the C cell. Centrally located nucleus is also present over here, and a short cell, its height is less, it do not reach up to the lumen. So there are two pairs of the parathyroid gland in human beings, the superior parathyroid and inferior parathyroid. Superior parathyroid developed from the fourth brachial pouch, and inferior parathyroid developed from the third brachial pouch, which is also your MCQ as well. So histologically, two types of cells are present in the parathyroid gland. These are the principal cells and the oxyphil cells, which constitute the substance of the parathyroid gland. Parathyroid glands are basically embedded in the substance of the thyroid gland. So here you can see the two different populations of the cells of the parathyroid gland. These cells are the main cells, the chief cells are the principal cells, and these cells are the oxyphil cells which are present over here. So oxyphil cells either present singly or sometimes present in clusters. So in this slide, which is stained with H and E, you can see clusters of the oxyphil cells which are present over here, and here you can see the principal or the chief cells. So principal cells are the pale staining, slightly acidophilic or eosinophilic, contain lipophilic skin containing vesicles, large accumulation of the glycogen and the lipid droplets as well. Small dense membrane limited vesicles seen with TEM are, after using special stain with light microscopy, are thought to be the storage form of the parathyroid hormone. So this is the electron micrographic picture of the chief cell. Here you can see the nucleus. This is the accumulation of large amount of the glycogen which is present in the cells. These are the lipid droplets which are present in the cell. These are smaller secretory vesicles you can see over here, and these are the tight junction or the desmosomes you can see. This is the basal lamina. These are smaller secretory vesicles also present over here, and these are the mitochondria. So you can appreciate in this transmission electron micrographic picture that large amount of the glycogen as well as large amount of the lipid droplets are present in chief cell. So this is the site of the lumen where you can see blunt microvilli are also present in chief cells. Oxyphil cells constitute minor portion not known to have a secretory role. They are found either singly or in clusters, and cells are more rounded, usually larger than the principal cells, and have distinct acidophilic cytoplasm. So these 2 points, larger than the principal cell and prominent acidophilia, and a rounded cell either present singly or clusters, these points help to differentiate between the principal or between the principal cells and the oxyphil cells. So this is H and E staining. Here you can see larger rounded cells which are show the strong eosinophilia, and these are the oxyphil cells. These are the smaller cells which show basophilia, and the rounded nuclei, these are the chief cells. This is the scanning electron micrographic picture of the oxyphil cell. Here you can see the nucleus which is present over here in this diagram, and the arrows shows the presence of the mitochondria. In this diagram you can see irregular shaped nucleus and usually vacuolated cytoplasm because of clearing of the water and the lipid containing droplets from here. And in this diagram you can see the vacuoles which are present, the rough endoplasmic reticulum is present. These are the these are the mitochondria which are present over here. The secretory granules are present over here, also the secretory granules. These are the lipid containing vacuoles. All these are the lipid containing vacuoles, and here in this corner you can appreciate the nucleus which is present over here. So this is H&E staining. You can compare both the thyroid gland and the parathyroid gland. These are the thyroid follicles having different sizes, lined by the simple cuboidal epithelium, and in the center filled by the colloid. Here you can see large number of the principal cells which are present, and scattered in between the principal cells singly or sometimes in clusters are the larger rounded cells which show the strong eosinophilia, and these are the oxyphil cells. Among these cells, large number of the fenestrated capillaries are also present, which is the feature of all endocrine glands. Here also you can appreciate the larger amount of the blood vessels. So these are the references: the basic histology by Laikus Siddiq, the histology text and atlas by John Quera, and histology text and atlas by H. Ross. And thank you very much for your attention for the today's class, dear student. And in the next class we will inshallah do the adrenal gland. And till then, Allah Hafiz.